Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
It seems most of us only hear about Parkinson's disease when a celebrity is diagnosed. Michael Fox, Muhammad Ali, and Neil Diamond, to name a few. But about 60,000 Americans are diagnosed with Parkinson's every year. What do we know about it? What can we do about it? And who's at risk? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Welcome to Healthy Living for Life. We're going to start our program by talking with Susan Rice, who is living with Parkinson's disease. Thank you so much, Susan, for being on our program.
Thank you for asking me.
Can you go back to your earliest symptoms and describe what they were and when you first started noticing that something was wrong?
Yeah, I think about 2 years before my confirmed diagnosis, I experienced occasional leg cramps, tension in my muscles, tremors in my right hand, freezing, not being able to take a step forward. But they were isolated incidents, and they didn't really add up for a while. And then they started piling up, and that's when the neurologist thought we were talking about Parkinson's.
How long have you lived with Parkinson's? So in other words, when were you diagnosed?
20 years ago this month.
Wow.
Yeah.
Describe the tests that you would have had.
Well, that's the problem. There isn't a good test to tell you whether you have Parkinson's for sure. There were a couple tests done to eliminate things like multiple sclerosis and a brain tumor. Those were eliminated. Then the confirming thing is if you respond to carbidopa-levodopa, the medication that is standard for Parkinson's. And I responded positively to that. I regained a smoother gait of swinging my arms. I felt better. The tremors were generally under control. It seemed to work, and so that confirmed the Parkinson's diagnosis.
What did your doctors tell you could expect with Parkinson's?
Well, he said it was kind of like bumper cars and stop and go traffic and a roller coaster all at the same time. Every day is different, every week, every month. The progression is slow and then fast. It's hard to predict, is what he said. You're just going to have to ride with it. So that's what we started to do, ride with it.
Every day is a new day, it sounds like.
It is a new day, yeah. which gives you a new start. That's not all bad.
What a positive way to think about it, Susan. That's remarkable. You've been living with Parkinson's for 20 years. My goodness. Describe for our viewers what your day is like.
Well, my day now is much different than it was, say, 10 years ago. Now my world has shrunk considerably because of my problems with falling and walking on uneven ground. I have had a couple of spectacular falls. So far, no broken bones, just a bloody nose. But I do have to be very careful about being out and about unsupervised, so to speak. I usually have a friend or my husband or a family member with me. So my world now is reduced to being at home. It's not unlike being sheltered in place. I was a good candidate for that. Sheltering in place, I already was sheltered. So, but until 10 years ago, I really got around. I worked, I drove myself, I had a couple of jobs. I did all sorts of things. And then gradually, the world sort of began to shrink on me. I did have DBS, deep brain stimulation surgery, which helped considerably. That extended my abilities quite a bit. And that was good move. That was 6 years ago I did that.
So can you talk about what you just described? Deep brain surgery, is that what you said?
It's kind of like a pacemaker, only the stimulus is in your brain, not your heart. And the battery is inserted up here just like a pacemaker. And it stimulates the part of the brain where the irregular pulses are coming from. And so it helps to reduce the dyskinesia, the random movements. You can see I have a fair amount of it, but still a lot less than I did have. So it's regulated by my neurologist periodically to change the settings to accommodate what I'm going through.
Well, that's remarkable.
That also helped change some of the medications that I needed. And anytime you can reduce the medications, that's a good thing.
Well, that has to be the case. What about other therapies? So do you use physical therapy or anything else to help?
Yes, physical therapy is great. It really helps with the balance and mobility training. And the whole idea that your brain can be retrained is really true. If you stick with physical therapy and the big program where you exaggerate your motions, you can regain some of your balance and your mobility. So physical therapy. Then I've taken boxing, rock steady boxing. I've taken yoga for Parkinson's, dancing for Parkinson's. There are lots of activities that are offered or that you create yourself that balance out the importance of the medication. You need your medication first, but you need those other activities right up there with the medication.
So, Susan, you are a remarkable advocate, and our time together has drawn to a close. I can't thank you enough for sharing your personal story and advocating for other people with Parkinson's. Now it's time for a break. Thank you for being on our show. And coming up next, we're going to be talking in more detail about Parkinson's, so please stay tuned.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Life is made of stories. Stories that we all share. But some of us have a hard time reading due to a vision, reading, or physical disability. The Montana Talking Book Library is here to help. Call 1-800-332-3400 to learn if you qualify for this free service, because no story should go untold.
Welcome back to Healthy Living for Life. We're now joined by Dr. Nicole Clark, a neurologist at St. Peter's Health. Dr. Clark, thank you so much for joining us today.
Thank you for having me, Sarah.
So we're talking about Parkinson's disease. What exactly is it?
So Parkinson's is a disease of the brain where there is a trouble with the coordination center of the brain. So more specifically, people lose the center of your coordination system, where they don't have a chemical called dopamine to get those connections to initiate movement correctly.
Most of the time we think about Parkinson's in terms of shaking and tremors, but are there other symptoms that we should learn about?
Yes, there absolutely are lots of other symptoms. Some people tend to have what we call a tremor predominant. So remember I said it's a disease of difficulty initiating movement. So I explain it to patients as the tremor is too much movement. When you're shaking, your body wants to start movement too much. But there's also a rigidity or stiffness predominant form where it's hard to get started moving. And we see that part come through with difficulty starting with the first step when you stand up, difficulty reaching for an item, or difficulty even in picking something up. And sometimes the rigidity and the tremor predominant are mixed. So sometimes people can have both a tremor and some stiffness involved.
Because there are so many different types of symptoms, as I'm learning, how does a physician identify the real cause and that it's Parkinson's?
Mm-hmm. Sometimes it can be difficult. There are some other diseases that mimic Parkinson's, or sometimes we say they're the cousins of Parkinson's disease. And sometimes it really takes time to be able to divide that out because some of those specific extra symptoms don't show up for 6 or 12 or 24 months. So sometimes it is very difficult and it can just take time. A lot of times we use medications and actually replacing that chemical called dopamine. And if people respond to it, then that does give us our diagnosis. But it's also a matter of ruling other things out.
Are there people that are more at risk for developing Parkinson's than others?
There is some genetic tendency towards Parkinson's. Particularly, we've identified a few genes of early onset Parkinson's. So when you have a family history of Parkinson's starting in your 30s or 40s, then you have a higher risk of it. We also know that people have higher risk with multiple repeated head traumas. That's part of the suspicion with Muhammad Ali, for example, and boxing, repeated small blows to the head that could have caused this damage.
I've read about the 5 progressions of Parkinson's disease. Does everyone go through all 5?
Eventually they do. Stages of a disease, especially for something like Parkinson's, can vary. And sometimes people may stay in a stage 1, and those are somewhat arbitrary, but someone may be a stage 1 for almost a decade before they actually progress. And yet some people progress very quickly to the end stages.
We interviewed Susan Rice, a patient of yours, and what a strong advocate for Parkinson's. So her progression has been occurring over 20 years. Is that normal?
So yes, Susan Miles is a wonderful advocate for Parkinson's disease. And she really has been through the gambit of treatment opportunities, both medication and let's say alternative with a deep brain stimulator that she had talked about a little bit. That is a typical progression, pretty average. And what she described that she was doing really well for about the first 10 years of her disease really is pretty typical. Like I say, everyone progresses at a little different rate, but usually the first 10 to 15 years, we can control it really well with just medications and keep the symptoms in check without interfering in your life very much.
We've got about 30 seconds left. Can you talk about one other complication of Parkinson's?
So one other complication that we don't think of often would be sleep apnea that can happen more often. And I'll throw a second one in there, that people with Parkinson's are more at risk for melanoma. So they should keep an eye on any skin lesions because there is a link with melanoma. So if you have Parkinson's, get that suspicious mole checked out.
Great information, Dr. Clark. So we need to pause for another break, but when we come back, we're going to talk about treatment and research related to Parkinson's. So please stay tuned.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Montanans are independent. We're also responsible, protective, and committed to our families and communities. That's why we've done so well against COVID-19. As we open up, we've got to keep doing what we do best. And it starts with each and every one of us, protecting public health in the 406 for our families, friends, and neighbors. We all have to do our part. Montanans get that. And we've got this.
Final call for flight 566.
Hello, gentlemen. May I see your Montana Real IDs?
IDs? Why, I'm Captain Meriwether Lewis.
And I'm Captain William Clark.
Hang on, I see more than one William Clark.
It's the real me, I promise.
Discover more at mtrealid.gov. Available now.
Montana Real ID. It's the real me.
And me.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Dr. Clark is still with us, and now we're going to be talking about treatment and research related to Parkinson's disease. So again, Dr. Clark, thank you for sharing your information. Let's talk about timing. When should a person who has a few symptoms, like Susan Rice described, go see a clinician?
So the time to see a clinician is anytime you have concern. There are sometimes other diseases that can look like Parkinson's initially that we may be able to diagnose. As we mentioned in the last segment, it can be difficult sometimes with initial symptoms to confirm a diagnosis, but it's better to get started sooner rather than later.
We know there's no cure for Parkinson's, and clearly you have been a neurologist for a while. Have you seen a lot of treatment changes with Parkinson's over the years of your practice?
Unfortunately, we haven't seen a lot of substantial changes. There are some new formulations, but we still rely on medications like Sinemet. Carbidopa-levodopa is called Sinemet, is still our mainstay of medical therapy. We've had a couple of other medications come out, things like rasagiline, that can help and certainly work in concert with the other medications to make them work better. However, we're still using a lot of the same medications that have been around for 50 years.
Susan talked about physical therapy as another modality in helping her deal with Parkinson's. Talk to us about that.
So physical therapy and really any physical activity is vital with Parkinson's disease. And really, I have seen patients where sometimes increasing their physical activity level helps control their symptoms more than any medication I can add. So any sort of activity is wonderful. Susan had mentioned the Rock Steady boxing program that we have all over the state. Different groups have set up. I usually see people in Helena and Butte, but there are different Rock Steady boxing programs all over. There are programs online, like for yoga and dance dance PD. And just getting out and walking or bicycling, anything that is exercise is going to help your symptoms.
I have to ask you about what I heard you describe as Rock Steady boxing. What is that?
So that's a group that is nationwide, but they have set up in several cities in Montana. And they focus on this idea of boxing exercises and the movements of boxing to encourage full range of movement for Parkinson's folks. So it gives you something a little bit different. A lot of times they have, for instance, caregivers holding a bag and the Parkinson's patient is making a punching movement. And it's fun and gets them active.
Many people with Parkinson's describe sleep problems. What can be done about that?
So sleep problems can come in many forms. Certainly people with Parkinson's disease are more likely to have sleep apnea. and sleep apnea when you're not breathing well at night or you're gasping for air. And that can be treated with a CPAP machine that helps you breathe at night and keep breathing. And sometimes people have difficulty with Parkinson's having movements at night and behaviors. So there are times when people act out their dreams at night. And if that's happening, you need to let your doctor know, because it may indicate that there's something a little different than true Parkinson's disease going on.
When we were interviewing Susan, I had a chance to meet her caregiver, her husband, one of her caregivers. Talk about the caregiver role as it relates to persons with Parkinson's.
Sure. It definitely helps to have a strong partnership. And a strong partnership with a lot of patience. I think that helps. What I have seen, it helps people who have Parkinson's to be more patient with themselves, because they're moving slower. They may be using an assistive device. Sometimes they just freeze or can't take another step because of the Parkinson's. And having someone with you who can help you, but also help you accept those challenges and work around them, is very vital.
So in the about 30 seconds we have left, can you give us a couple of resources that people can go to?
Sure. So there are some great resources in the Parkinson's Disease Foundation, but also the Michael J. Fox Foundation and the Muhammad Ali Center. And for all the people who snowbird down to Arizona, it might be worth a trip to the Muhammad Ali Center there. In Phoenix, I've sent several patients down to see that multidisciplinary approach. It can be very invigorating and make you feel really positive about the disease.
Thank you so much, Dr. Clark. And thank you, our viewers. We're out of time for now, but in the meantime, be sure to join us next week. And until then, stay fit, stay well, stay healthy for life with Healthy Living for Life. And please stay safe. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.